Greetings and welcome to the third annual Latinoamericano Foro, sponsored by our wonderful partners, Planetree Brazil, Planetree Latin America North, Central, and South. I'm Susan Frampton, President of Planetree International, and I'm proud of the work being done to build a community of person-centered care across the South American continent and Southern North America. The work being done by all of you together has never been more important than it is right now. The past several years have brought incredible changes to our world and to healthcare in particular. And while we could focus on the challenges and the hardships, we choose instead to focus on the incredible opportunities that we've been presented with and the creativity and innovation exhibited by people around the world as they've come together for a common purpose. Together, the global scientific community has moved the model of what's possible, for example, in vaccine development, as researchers from around the world collaborated using knowledge gained by previous coronavirus epidemics to beat the previous record of 4 years in developing a vaccine and developing one in the space of 1 year. Fortunately, the global infrastructure for collaboration and sharing was in place and quickly expanded upon. Similarly, in our person-centered care world, we too have a global community of practice, able to come together and share our experiences to prepare for our future challenges. Together, we've changed the way and the places in which we deliver and experience care. We've seen a paradigm shift in care delivery, particularly with the widespread adoption of telehealth and other virtual adaptations, hospital care at home, remote monitoring, mobile collection for lab tests, do-it-yourself home testing and screening, all have proved to have distinct clinical and public health advantages. Healthcare has risen to the challenge of making services as accessible as possible, as safely as possible, and found ways to bring care to many people, meeting them where they are, and in so doing, increasing accessibility, convenience, and safety. However, not everyone has had the same access to screening, vaccination, and treatment. For example, funding for these essential services has varied greatly across Latin America. The pandemic heightened our awareness of the disparities in access to care, both around the globe and across our own nations. It has encouraged us at a much deeper level than ever before to examine the varying experiences of groups within our societies and how those experiences have shaped their beliefs about and degree of confidence in the healthcare delivery system. This increased consciousness of inequities in care has shifted needed attention to addressing this opportunity to improve our healthcare systems so that they can do a better, more equitable job at meeting the needs of all of our citizens going forward. At Planetree, diversity, equity, and inclusion are at the core of who we are and the work that we do. Our commitment to these principles is the foundation of our relationships with our partners and affiliates around the world. They are at the core of our mission and vision to empower all people to humanize the care experience, supporting a wide variety of perspectives and needs that characterize our complex and increasingly diverse world. Together, we've also experienced the power of empathy and compassion and the very human drive to reach out, to connect, to understand and support one another in times of crisis. We learned hard lessons over these last 3 years about the effects of social isolation and delayed medical procedures and preventive care as our healthcare system struggled to respond to the pandemic. And we were reminded also of the fundamental needs of families to be together during times when they feel most vulnerable. Amidst these challenges, we saw many examples of creative solutions that strove to balance safety with compassion, including many new and expanded virtual options for care delivery that will continue to reshape what care looks like in the future. A part of our job is to ensure that virtual care is person-centered care and that our care providers receive the skills training needed to feel comfortable and competent to deliver care over the phone or over a screen or via an app. But we also need to acknowledge what the emerging evidence is suggesting, that access to the internet is not evenly distributed, nor is availability of tablets and smartphones, and that virtual interactions don't take the place of in-person interactions, regardless of how skillful a provider may be. We must continue to promote thoughtful policies that protect the roles of essential family caregivers to be present with loved ones now and in the future across all care settings. Planetree was very concerned about this issue as we saw tragic stories unfold early in the pandemic. Stories of patients dying alone in hospitals, of nurses and doctors overwhelmed by the responsibility for not only the physical care of patients, but for meeting all of their spiritual and emotional needs as well. Stories of elders developing dementia and despair, isolated from their loved ones in long-term care facilities. And we mobilized our global community of practice to raise our voices in support of the needs of patients, residents, their families, and our staff to balance care between an approach where family presence can be emphasized safely with safety and quality concerns. We're now seeing a movement emerge for the rights of patients and families to be together in healthcare settings, and we must be prepared to safely support those needs and preferences. In the U.S., for example, there's legislation now requiring hospitals and long-term care facilities to allow family to be present at appointments and at the bedside, including these examples of the No Patient Left Alone Act and the Essential Family Caregiver Act. But we also have to be realistic and understand the unprecedented stress on our workforce, on our healers. We have to find ways to balance the needs of patients and families with the needs of our staff. We must acknowledge the fact that violence against healthcare professionals and caregivers has increased since the beginning of COVID, that some of that violence includes both verbal and physical attacks by patients, their families, and visitors. Recent surveys by global nursing organizations have found that close to 60% of nurses have reported an increase in violence since the pandemic. Similarly, in surveys of doctors, they've reported increases in violence against them, including digital attacks and harassment on social media. And so we have to find ways we can heal together, and we have to find opportunities to not only honor and celebrate our staff, but to protect the safety and well-being of our staff also. And so this is why we're here together today. Together, we can work on solving problems, on developing innovative solutions and tools that will move us into the future of what person-centeredness will become. What that future holds depends on each of us. Please take this opportunity to listen and learn and take back ideas and solutions that will expand on the advancements in patient and family engagement and staff support that emerged as pandemic-applied solutions, and find ways to firmly embed them into how we support health, wellness, and resiliency for all as we move forward. At Planetree, our model of person-centered care has always been founded on understanding and responding to what matters most to patients, to family caregivers, and to healthcare workers. And what matters most are human connections. In study after study, health service researchers have found that the top factors in an ideal healthcare experience all center on the theme of trust. That what makes a healthcare experience ideal is interacting with a trusted healthcare team that takes the time to listen and to show they care. Similarly, our healthcare workforce needs to have their trust restored as well. Trust in leadership to support their emotional as well as physical well-being. Trust in one another to offer kindness and understanding of our common challenges. And trust in our patients and their families to respect and appreciate what we do for them day in and day out. We are here together at this Foro to take up this call to action, to find ways to ensure that we continue to balance high quality, safe clinical care with compassion and partnership among patients, their families, and our teams. We're here together to recommit to person-centered values and to lead our organizations into a brighter future. And I want to thank each of you personally for the essential part that you each play in making this vision a reality.